Patients often ask, "I've already been in rehabilitation for months. Do I still need therapy? How long do I need to keep wearing my pressure garment?" These are difficult questions and very common in burn rehabilitation. To answer them properly, we need to understand one key concept. Has the burn scar matured, or is it still biologically active? In this video, we'll break down the stages of burn scar healing, typical scar activity patterns over time, and how therapists can think about scar maturity in clinical practice. This is the foundation for decision-making, but not the entire decision-making process. 4 tips, how-tos, and videos on burn rehabilitation. Subscribe to Sunshine Training YouTube channel or visit our blog at www.sunshinetraining.org. First, it's important to remember that not all burn wounds will develop hypertrophic scars. The risk increases significantly when burns are deep partial thickness or deeper, or take longer than 2 to 3 weeks to heal. These wounds involve deeper dermal damage and prolonged inflammation, which increases scar activity during healing. Healing time and wound depth are 2 of the strongest predictors of hypertrophic scar formation. Understanding this risk helps therapists anticipate which patients require closer long-term monitoring. Let's now examine the 3 stages of burn scar healing. The first phase is the inflammatory phase. This early phase involves vasodilation, increased capillary permeability, white blood cell migration, and macrophage activity. Clinically, we see redness, warmth, swelling, and pain. It usually lasts several days, but may extend beyond 1 week. During this stage, rehabilitation focuses on pain control, protection, and edema management. The proliferative phase begins around day 4 or 5 and may last several weeks. It involves rapid angiogenesis, fibroblast migration, collagen synthesis, granulation tissue formation, and wound contraction. Clinically, wound closure progresses and tissue repair accelerates. Rehabilitation during this stage emphasizes gentle movements, preventing stiffness, and supporting tissue elasticity. The remodeling phase is the longest and most clinically significant stage. During remodeling, collagen is continuously synthesized and broken down. If synthesis exceeds degradation, hypertrophic scarring may occur. Over time, collagen fibers reorganize and equilibrium is gradually reached. During this phase, rehabilitation will focus on maintaining scar softness and control hypertrophic growth. Ongoing, individualized rehabilitation interventions will aim to counteract ongoing scar contracture. Continuous monitoring and adjustment, not passive waiting, is necessary to prevent problems from happening or worsening. True scar maturity does not mean the scar disappears. It means collagen synthesis and degradation have balanced, and the scar is no longer actively thickening or contracting. This process may take 1 to several years. Why the remodeling phase is the core rehabilitation period. Many patients assume that once a wound has closed, healing is complete. But in reality, scar tissue often becomes most active after wound closure. Scar tissue remains biologically dynamic. It can thicken, contract, change texture, and restrict movement. Clinical decisions during this stage should never be based on time alone. Instead, they must be guided by scar behavior. Burn scars change over time. Time is not a rule, but trends can guide expectations. 0 to 3 months after wound closure, the skin is still fragile due to weak tissue connections, and there is a high risk of shear injury. 3 to 6 months after wound closure is often the most aggressive stage. Rapid collagen synthesis that exceeds the speed of collagen breakdown will result in thick, firm scars. Rapid angiogenesis will result in redness and vascularity. Granulation tissue formation will form. Patients will start feeling itching and discomfort. And as the wound closes by contracting towards the center, we will start seeing the progression of scar contracture. This is often the most frustrating period for patients, as they may feel their efforts are not working. But this phase reflects active scar biology, not treatment failure. 6 to 12 months after wound closure, scar activity slows down but remains present. Therefore, continued monitoring is essential. As we move beyond 12 months after wound closure, collagen synthesis and degradation approach equilibrium. Scars become flatter, softer, less vascular, and less reactive. This indicates scar maturity. How to clinically assess burn scar maturity. In most settings, we rely on clinical observation to assess burn scar maturity. And although scar color is one of the evaluation criteria in scar evaluation tools like the Vancouver Scar Scale or POSIS, relying on color alone is unreliable. Instead, we must also consider scar pliability, thickness, rate of contracture, and functional limitations. Scar maturity must be determined by combining expected biological trends and current scar presentation. That's because different body areas mature at different speeds. Scars do not mature simultaneously. Therefore, time is a reference, but it is not an absolute rule. The actual scar behavior is the key indicator. Understanding scar maturation is not only for therapists. It is essential for patient education. A helpful explanation might be, even though your wound has healed, the scar and tissues underneath are still actively changing. The scar may thicken or tighten before it settles. That's a normal process, and it does not mean rehabilitation has failed. During aggressive phases, progress may mean preventing worsening and not necessarily seeing immediate improvement. Managing expectations reduces frustration and supports adherence, and we will discuss in more details in other videos about communication strategies that therapists can use throughout the patient's rehabilitation journey. In conclusion, burn scar maturation is the biological foundation of burn rehabilitation. Understanding it helps therapists anticipate scar behavior, educate patients, and guide clinical reasoning. However, knowing the stages is only the first step. Applying this knowledge to make safe, individualized treatment decisions requires deeper clinical analysis. If you're interested in learning more about scar management in terms of intervention timing, pressure therapy adjustments, and decision-making, we invite you to explore our online courses. You'll find practical, evidence-based content designed for therapists who want to advance their skills in burn rehabilitation. You can find more information on our website or in the link provided below. Thank you for watching. Remember to subscribe to our channel for more burn rehabilitation-related tips and videos, and visit our website for news about our latest training programs.